Hello everyone, so our topic for today is Master Patient Index. Let's start with the introduction.
The Master Patient Index, MPI, has many aliases such as Enterprise Master Patient Index, EMPI, Patient Master Index, Patient Registry, or a Client Registry. The MPI is an electronic database that contains critical demographic information on every patient who receives healthcare services. This is through the location of every patient's complete and accurate medical information or records. The MPI aims to accurately match and link records by uniquely identifying individuals. This is done through storing information such as name, date of birth, gender, and many more factors, and assigning everyone a unique identifier. The Master Patient Index has various benefits. For this video, we have listed down 5 benefits of the MPI. So firstly is the accurate identification of an individual and their health records quickly when using a health service. 2, up-to-date information anytime and anywhere for access of these healthcare services. 3, to ensure medical staff have the correct and most up-to-date health record of the right patient. 4, it improves patient health, patient safety, sorry. Let me repeat that. Number 4, it improves patient safety by reducing risk to error due to misdirection of clinical information. And 5, supports the provision of cost-effective and timely healthcare services.
The common issues faced in MPI.
Hi everyone, my name is Genevieve. I'm going to tell you guys about one of the common issue, which is duplication in the MPI, where a patient is having more than one medical record number or MRNN. So by having this kind of issue, it can lead to incomplete information, duplicate procedures performed, reimbursement or claim denials, and potentially medical malpractice risks. So this issue can be fixed by merging all the multiple mRNNs into one single active mRNN.
Hi, I'm Simma. I'm gonna move on and talk about the second issue faced in our MPI system, which is unique network of various software systems. With this I mean that naturally MPI is a central unit where it compile all the demographic data of the patient from different softwares from various clinics and departments. So each of these softwares would be different, and the settings they have are also different, which means when there is a mistake, the human error that Jean, my friend, mentioned earlier, where on the duplicates and overlay will happen, when they have to make the change for the patient info, they have to undergo a different procedure in order to make it into a one file, one data. So the person in charge or the department in charge to maintain or fix the errors are Health Information Management Department, but they have to get the cooperation from all the other departments involved in the particular patient data entry, like Oncology Department, Emergency Department. This makes the process of fixing the problem prolonged. That's one. Another one from this problem with the various software system it's because the duplicates and the error is actually noticed only when the patient arrives to the hospital and the registration department is going through the patient data, and they find out, oh, there's another patient data from this department where there's maybe a typo, like a spelling error, or a number, or there's nicknames which is the same patient and all. So when this happens, the process of fixing this problem is going to be prolonged, and obviously the backlog of the known errors is going to be created because they need to take time to fix the error. So that is one problem. So in order to maintain or avoid this problem is to conduct a routine maintenance by auditing the MPI for errors and duplications, which means like probably every week or they make an audit where they will make sure all the duplicates and errors are fixed by time, and they can also eventually reduce the errors by training the staffs to have a fixed rule on how they taking the patient name, which means like no nicknames, only full names, like that, or like increase another way of searching the demographic data. As a research I found regarding MPI issues on discrepancies and the prolonged process on fixing the discrepancy due to the software package they use. It is a healthcare facility located in Richmond, Virginia. The research was done by Matthew Whittle. Due to the high volume of patient in this healthcare facility, they also use a poor, can be called poor software, like not well developed software package called the GEIDX, where the software system is different in all the departments, and in order to fix this, they had to go through a whole long of process. So due to this, they also didn't get due to the backlog of the errors, they didn't get to fix the problem on time. During this research, they took a few steps to reduce this problem. So they also had this the maintenance routine maintenance audit that I mentioned, and a little improvements were seen on the system, where the duplicates and errors were actually fixed eventually. So this research is to support my statement. Thank you.
Hi, I'm Erina. So the next issues I'm going to talk about the minimum clinical data set (MCDS), or known as minimum data set (MDS). So it has been severe issues in healthcare information sharing platform, where the information were shared in one platform and any hospital can just go through it. So the problem rise relate to the patient data sharing in different domain system, and it has no clear unifying definition and has been poorly defined. So there's one developer, Savage Jane, who developed a prototype for this MPI system with a detailed design concept for a public use in order to solve the problem of the patient data sharing in different domain system. So this actually helps provide a better service by linking various secluded health domains to external system. So the team developer, they try to prevent the duplication in this system, because it happens before in the emergency department that this story was published by Dr. Fennell about the doctor at emergency department misdiagnosed because there's a duplication of patient information in the system. So this is why the team developer trying to prevent the duplication, and they were gonna introduce the solution for a unique identifying mechanism by develop a merging program called as stacking. So based on the picture I've shown, what if a patient that have a several first name? So this MPI will just go through the patient data, the patient background information, and if it's a similar, they're just gonna combine it and be in one. So this MPI, every hospitals can just go through it and just find, then there is no mistake such as duplication. For example, in the picture, hospital 1, the patient names Bruce Wills, meanwhile hospital 2, Bruce Wills, and both are 66 years old and they are his ID. So when this they were registered under MPI, so MPI system will just go through, even though there's a several first name in this one patient. So when the information, as I said, similar, they're gonna combine it, gonna merge it. So that is where on the picture, Bruce Wills is the name, 66 years old, and there is his ID of EMPI ID 84. So every hospital, whenever this patient Bruce Wills go to any hospital, those hospital can just go through this system and get all about this patient information, what is his medication that he's take, what treatment that he's been gone through. And I think that is all from me, and thank you.
So to conclude this presentation, even though the MPI system is very useful and has many benefits, there are some instances or incidents where error or mistakes tend to happen when using the master patient index. Thank you very much for watching. I hope you enjoyed our presentation.